Now, as you know, we have recently started with our hub strategy, and so wanted to talk a little bit about that because beginning in week 5, which was the week of the MLK Day, we initiated our hubs, and this was an effort to do big high throughput and trying to get a lot of people vaccinated every single week. Now, the goals of those hubs, we're now in our 3rd week, so we're really happy about the progress that they have been making, is a couple of things. So the 2 big benefits that we get from the hubs is that, one, for the people looking for vaccine, they have a few places that they know will definitively be getting it and have ways for those members in the eligible 1A or B populations to get access to it. And they don't have to go and look for, dozens of providers every single week in order to find vaccine. For the providers, having a dependable supply of vaccine each and every week is exceptionally helpful for them so that they can plan their efforts and know when they need to have either a single large event or multiple smaller ones. Some of them are doing, moving around and doing some mobile sites. Others are partnering with other providers in their community to help provide vaccine at specific at-risk population groups and locations. But ultimately, we're not 100% sure each and every week about what that vaccine allocation will be. And so with the guarantee of the hubs that they get at least that minimal amount helps them plan moving forward. Now, in looking forward, the past 3 weeks we have been, the past weeks 5, 6, and 7, we have added hubs. For week 8, because I don't know yet if that is going to be a sustainable increase in vaccine, we won't be adding any hubs. We're going to wait a week to see what the week 9 allocations look like. And that's really because while the federal partners have told us that this is going to be a reoccurring thing, we really need to see it in writing and when we actually get our numbers before we make additional commitments to our providers about reoccurring amounts. And so for this week, we won't be adding, for this coming week, we won't be adding any additional hubs. Now, in exchange for that steady supply of vaccine, the hubs have to agree to a variety of different things. And so, wanted to just take a little bit of time to walk through what those requirements are in knowing what to expect from our hubs. And so first, they need to strategically place vaccines within their sites to serve and maximize the vaccine efforts across the state. They are required to vaccinate 1A and 1B populations, and so we're specifically still focused on those groups of people. And they have to offer that vaccine to regardless of whether or not they are resident of their county. And early on we had very few hubs. A lot of counties still do not, and so we want to make sure that they are open to their neighbors and surrounding areas because we didn't have enough vaccine to have hubs in every single county. Now, the other piece is, and this is a really important one, they have to use every single dose within that week that they received it. And so they need to burn through it within those 5 to 7 days. Another requirement is that it's imperative that there be an equitable distribution throughout demographics and looking at the hardest hit zip codes. And so we do talk to them about this. There is some flexibility in how they go about doing that. As far as reporting doses, we tell them they have to use each and every dose the very week that they get it. But equally important is that they report that to the state. And so they are required to report not only to our immunization registry in Track 2, but they're also required to report to the Texas Division of Emergency Management's reporting portal as well. And so that's to make sure that we have the best information on how many doses they're going through each and every day. In order to ensure that they are following all the safety requirements, they have to, obviously monitor for adverse events. They need to report adverse events to the VAERS system, and then they are required to promote and encourage the Be Safe application as well. But finally, I wanted to say a couple of things about distributing vaccine equitably, because we know that that's been talked about quite a bit. It is absolutely a priority for our expert vaccine allocation panel. It is absolutely a priority for us here at the Department of State Health Services. And for me personally, it is a priority. And so not only equitably distribution across the state, but also within the cities, counties, and particularly in areas that are typically underserved by the healthcare system. We work to try to target particular areas and providers. For example, we have focused on federally qualified health centers over the past few weeks, and these are centers that serve patients regardless of their ability to pay. We are directing our hubs to make sure that they serve diverse and hard-hit populations, but we also know that our local partners play a really critical role in this. They know their communities best, and they know how to reach those diverse populations that they have. So we try to work really closely with our local partners and help direct providers, direct vaccine to those providers and areas to make sure that vaccine is available. So in closing, we have 2 million doses administered and 1 in 6 65 and older having received their first dose. We have made a really strong start here in Texas getting folks vaccinated and taking critical steps to ending the pandemic. But we still have a way to go, and we'll get there together. But for now, as we continue to see more than 15,000 confirmed cases and more than 300 deaths reported every day, we need everyone to continue to take precautions like wearing a mask anytime you're around someone you don't live with, maintaining physical distance with others, staying at home when you can, and washing your hands frequently. And the more that we all do these things, the more effective the vaccine will be in reducing the number of cases and helping us get the pandemic behind us. So with that, Chris, let's go ahead and open up for questions.
Sure thing, Alda. Thank you. First question comes from Valerie Gonzalez at the Monitor. She says, "Good morning. When will the vaccines begin to be distributed to the smaller private providers like pharmacies and doctors' offices?"
So we continue to provide vaccine to some pharmacies and some private providers' offices. But ultimately, with the strategy of us going to the bigger hubs, the majority of the vaccine is going to those bigger providers. As supply increases, and you'll notice in week 8 allocations that we have started increasing vaccine going to pharmacies and other providers as well.
Moving on to a next question. Sorry, it's scrolling here. Eleanor Dearman with the Fort Worth Star-Telegram asks, what kind of communication has the EVAP and DSHS had with the new Biden administration about their plan for vaccine distribution? What does the new administration what does the new administration, its plan mean for Texas?
So we have begun having some introductory meetings with the White House and their new team out there. I think we've had some really productive calls, hearing about their interests. They definitely want to learn what we are doing here in Texas. They are supportive of the work that we're doing and want to partner with us in order to how best get vaccines in Texans across the state. So we're going to continue to have that strong communication and collaboration. I think that, as they finally get more details on their policies and rollout, they will share that with us, and then we'll be communicating that further forward.
Kiera McCarthy with the Victoria Advocate asks, will vaccine hubs be prioritized for future allocations of vaccine? And as a follow-up, what was the rationale behind switching from distribution to numerous sites throughout the state to focusing on the hubs?
Sure. So within the expert panel, we did talk about prioritizing hubs and trying to get some bigger throughput. And this was largely driven because, as we shifted to the 1B population, just the demand for vaccine, really, really increased. So we wanted to afford a way to be able to do big numbers at strategic locations all across the state. Within the expert panel, we are having conversations about how long do we stay with the strategy before we pivot back to a more broader distribution across the state. And ultimately, a lot of that really depends on the vaccine supply. And so as vaccine supply continues to increase, we will have those conversations about when do we pivot back.
Moving on to a next question from Brad Stryker with KView. Can you please explain the strategy behind where we decided to put vaccine hubs and sort of how those hubs were selected?
Sure. So, initially we had 28 hubs across the state, and we had done a survey to ask folks what interest they had, who could do 2,000 a day during a week for the urban centers and 200 to 400 a day for the rural centers. And so we used some of that initial information to be able to target some high throughput providers across the state. So we did that within that first week and chose those providers that could do some big numbers. In subsequent weeks, we continued to get an outpouring of requests and folks laying out their plans as to what they could do within their communities in order to create a hub within those. And so each week, we've had a kind of determined process to be able to look and prioritize and getting vaccines to additional hubs.
A question from Brett Jaspers at KERA in Dallas. He says, good morning. There are about 45% of vaccinations that don't have race or ethnicity data. Why, and what can be done to fix that?
Thank you for that question. So the data just hasn't been submitted to our immunization registry. And so whether the providers are collecting it on the ground and just not entering it is unknown. But one of the things that we are doing to improve on the data quality, we're doing a couple of different things. So we're going to be moving to make the race and ethnicity field required in order for the vaccine to be coming through, as well as we're also going to be redoing the user module, what they see when they're doing data entry, to make it easier to facilitate completing that information. And so that is going to be one area that we monitor moving forward about the quality of the data that we have for race and ethnicity.
Great. Just as a reminder, and people are doing it, so I don't know that a reminder is necessary, but if you'd like to ask a question, you can just enter that in the question box that you should be able to see. Please do include your outlet when you're asking the question. That doesn't automatically come up, but it looks like most people are, but just a reminder so we can make sure we recognize you appropriately. So the next question from Meredith Yeomans at KXAS in Dallas. Can you comment on when the state plans to announce who's in the next phase of the rollout and when moving to the next phase is expected to happen?
So as an expert panel, we continue to have conversations about the 1C population and who will be in the next group to move forward. At this time, we haven't finalized that definition, but we will announce that once we have come to a final decision on that and communicate that broadly. As far as when we transition to the 1C population or the next group, that really is dependent on the vaccine supply and how quickly the vaccine increases and how quickly we can get through our 1B population. So that's yet to be seen.
Is there a couple of questions that are kind of follow-ups to that from a couple of folks as sort of how do we make that decision? How will we look at what's occurring in the state and decide, okay, when is it time to open up to whether it's 1C or 2 or whatever we call the next group?
So, for us here in Texas, we didn't wait until we did all of 1A before we transitioned to 1B. We were looking at vaccine uptake and hesitancy and seeing, how quickly vaccine was flying off the shelves. With 1B, we know that, we're going to be here for a while. But as an expert panel, what we have talked through and the team is developing are some metrics about what those trigger points would be. We do expect that there will be another blended transition where we would have 1B and 1C or phase 2, eligible next. But that's something that we're talking through. We will continue to monitor vaccine uptake all across the state and talking with our local partners to see if there's signals about, slowness in vaccine doses administered, or whether or not we need to kind of stay within that phase for a little while longer. So that's how we're thinking through it right now.
And one other sort of related question from Karen Harper at the Texas Tribune. Is there a consensus yet in EVAP about who's going to be in 1C, and what do you take into consideration when you're making those decisions?
So I can tell you we have some really robust conversations about our eligible populations, and we talked for several weeks on the 1B population before we finally came to a consensus in the 1B population. I expect that we'll be doing the same with the 1C. We have had quite a few conversations already, and what we're looking at is the data first and foremost. And so what are we seeing in Texas as far as vulnerabilities and outbreaks on the case data? We are also, looking to see how the federal guidelines have been, and so that we pivoted away from CDC earlier this year. But with the new presidential team coming in, we don't know if there will be some additional changes to the next eligible population that we may want to take into consideration for us here in Texas. So that's kind of some of the framework that we use when we're considering who will be next in the eligible population.
We have time just pushing up against the 11:30 here, so we have time for just a couple more questions. Santiago Caicedo at KRGV down at the Valley asks, does the state require that a person prove they live in Texas to get the vaccine? Can someone from another state or country on vacation get a COVID vaccine in Texas?
So if we really want to focus on the people that are living and working here. And so this is where if you may live in New Mexico but come to work every day in Lubbock or Amarillo, we want you to be vaccinated. And so those are the requirements and the things that we're looking for broadly. We know that there have been very small numbers of people that have been vaccinated from other areas beyond that, and it's minimally small. And so I think that the lion's share of what we're doing is indeed vaccinating those that live and work in Texas that are within our communities.
Closing it out, a question from Nicole Cobbler at the Austin American Statesman. Is there a concern that rural counties could be missed because of the hub system, and will the mobile pilot program solve these problems? And finally, does the state have enough vaccine supply to expand that mobile program?
So with the first question with regard to, rural versus urban hubs and things like that. So that's definitely always part of our conversation within the expert panel in talking about how do we ensure that our rural areas still have access to vaccine. We have continued to expand some of the hubs within rural areas to cover a variety of different rural counties as well. Now, the state's pilot right now, which we'll be rolling out here shortly, is an attempt to help be able to get some vaccines to areas that may not have gotten it sooner. So we're going to try this out, see how it goes. Every effort that we do to get more Texans vaccinated all across the state are essential partners to that. And so we'll continue to partner with the Texas Division of Emergency Management in their pilot and in their rollout, as well as continuing with our local partners to create more opportunities for vaccinations.
And one final question to end on from Wes Rappaport with KXAN and Nexstar Media. What's the sorry, that's not the one. Is DSHS satisfied with how many doses have been administered at this point? And I guess, Imelda, asking you, are you satisfied with how many doses have been administered?
No. I think we've done a great job so far. Let me be really clear. We've done an amazing job, but we know we can do better. And that is the reason why we continue to reiterate over and over and over again to all of our providers across the state, use the vaccine as quickly as possible. We want everyone to run out every single week. We don't want a single dose left on the shelf. It will only work if it gets in people. And so we are not satisfied with where we are. We continue to push. We're not satisfied with the supply that we're getting. And so we continue to push from that regard. So we will continue to work to improve how quickly we get it out. We'll continue to fight for us getting more vaccine to Texas. And ultimately, I know our providers are wholeheartedly dedicated to doing their part in using the vaccine as quickly as possible.
Imelda, thank you for being with us today. I know you have to step aside for another appointment. And thank everybody else for joining us as well. Thanks to Dr. Saroj Rai for being on hand. We didn't get into that nitty-gritty scientific stuff, but maybe we'll do that at a future briefing. This is something we hope to make more of a regular feature as we answer questions and about exactly what the vaccine rollout in Texas looks like. So again, thank you for being with us in this sort of initial attempt at that and navigating some new technology and helping things go fairly smoothly. I know there are many more questions. If most people know where to find us. If you have any follow-up questions, you can reach us at pressofficer@dshs.texas.gov. As I mentioned earlier, this presentation is being recorded, and we'll send out a link to that when it is available. Also, we'll send out the map that was presented earlier so that you can take a closer look at that as needed. Thanks for being with us today, and appreciate your attention on this COVID-19 vaccine update in Texas. Have a great day.